So often we as mommies have the tendency to compare our kids with other kids. And lately I've been thinking about that and wondering why we often do that. Hi, my name is Annie and welcome to Navigating the Motherhood. I've realized that most of the time our intention is not to try and figure out where our child is on a scale between friends and who's the best. They're not in a competition, but the question of our heart is my kid doing okay? Are they developing in a normal way? And so often the first thing we tend to do is to compare our children with other children. We compare our children with what is written in a book according to research. What is the norm? Norm being what is the middle of a graph of children that is being tested. And I think sometimes we miss that. We say normal is what they should do. Where if you look at most research, the norm would then be, if you have a graph, what would most children be doing? Not all children, but most. You always have some children developing prior to what the norm does, and some children will come afterwards. And there are many factors that actually has a very big impact on development and the rate at which every child is developing. So firstly, I want to encourage every mom that's got the question in my heart is my child doing okay? To ask a few questions. One, are they continually developing? Do you see difference day to day? Do you see growth? Do you see milestones that is falling behind, or milestones that is just slower achieved? That might put your heart at ease knowing that your little one runs their own race. So I also want to encourage moms that if you are really uncertain about what is going on, to seek professional help from a therapist or from a pediatrician. I know that there are children with shortcomings and struggles and developmental delays, and those are true. So often in our society, we are stubborn, or we don't want to label our children. I don't want to label my kids. I don't want to seek for help. We want to give our child freedom and free reins to do things at their own pace, which is all good and well. But I know that in a mommy's heart, sometimes there is something telling you that my child is struggling. My child is not coping with what is being expected. So in those moments, I want to advise and encourage every mom to go and seek professional help. My reason being, as a remedial teacher myself, I have two children. Both my children went through different sets of therapies and also medical interventions. My little son was born, my boy was born with alternating strabism, which was confirmed at the age of 6 months. And then from there, he started wearing glasses and we did patching. And I also attended vision therapy with him twice a week. At the age of a year, he had an operation where they worked on the eye muscle. And then we continued with the patching, the glasses, and the therapy up until 18 months, where we reevaluated his situation, and I got a list of things to do at home, and from the therapist, just some encouragement to keep on allowing him to develop in certain ways and with certain toys. And so yearly I went for an assessment, and we could gauge, is he growing? Is he continually developing? Is the brain interacting with the eyes? Is all his perception developing at a curve, at a rate? Even some of the things he really struggled with, it was very slow, but we could measure a growth in that. And so today I sit with a 6-year-old boy who loves life. He loves adventure and he's not scared. So I am grateful for the blessing that I had with therapists as well as surgeons who could very early on intervene in a medical way and help him and assist him so that his brain development and his coordinations developed from a very young age. Currently, he's not where the norm is. He's not where most kids are. I know that. But I also know that the important bit is that he continues to develop, that his depth perception keeps on being challenged and developed, that his eye movement continuously needs to be active. He needs to play outside in the sunlight for at least 4 to 6 hours a day to make sure that his eyes look far and near, is exposed to light and dark, and so much more than usual children would. But I'm thankful for the interventions there was, and that's why I want to encourage every mom that if you have the question, is my child doing okay? Is this normal? Or is this part of the norm? Remember, it's part of the norm, not normal. It is the norm usually states where a child should be around that age, to go see professional help, to see a health nurse or a pediatrician, and don't be scared of a therapist. Therapists are some of the most amazing people. They have a heart for children and a passion for what they are doing. So if your mommy's heart is not quite there, please be brave and ask for help.